So hello, everyone. I'm Lisa Bratzke. I'm an assistant professor here at the School of Nursing, and I'm super excited to talk to you today a little bit about the research that I'm doing and the outreach that we're working with, that I'm also doing. So a little bit, a couple of questions for you first as an audience. So how many of you here, as you're aging, are worried about your brains and your brain health? All right, yay. All right, how many of you here are interested in living in your own home for as long as you possibly can as you age? All right. So my research, the crux of my research, I'm looking at factors that affect our brains and that help us or hinder us from maintaining our cognition as we age. The other piece of my research is looking at individuals who are cognitively impaired, who have dementia, as well as their caregivers, and how we can better support them out in the communities to help them live at home as long as they possibly can. And how I came to that, my area of research is really very personally motivated for me, and so I always like to share a little bit about my story to begin with, to kind of give you guys an idea of where I'm coming from. So I am a first-generation college student. I was raised on a tobacco farm. I come from a long line of tobacco farmers. That is not a relative, nor did we ever look that good in the tobacco fields. So it was hard work, and I came to the university so that I didn't have to work so hard. And all of my nursing professors used to laugh at me when I would say, I don't want to work that hard, so I want to be a nurse. And I found out, yeah, there's lots of ways to work hard. So the real inspiration for my story and my research are the couple that are in the middle, and that is my grandma Charlotte and my grandpa Les. Their families immigrated here from Norway. And the house that you see on the lower right of the screen is the Cavalli House at Old World, Wisconsin. And that's my grandma's family home. And that's infamous, and it's part of Old World, Wisconsin, because it was the first home in the state to have gas lighting. And I mean lights fueled by gas, not the current political climate that we live in, gas lighting. So just to be clear. So Grandpa and Grandma were married. Shortly after they were married, he suffered from rheumatic fever. And she was able to nurse him through that, and the problem was that the cardiac sequelae that came about with the mitral damage. He ended up with atrial fibrillation, strokes, and heart failure at relatively early onset. They lived in their own home. Grandpa lived at home until he passed away. And watching him from a standpoint of the disease and what happened with him with heart failure, really, my bachelor's degree from here, my master's, and my nurse practitioner certification, I focused on cardiovascular health. And it was to help people like Grandpa. Grandma, on the other hand, is 5'1", so she claimed at one point in her life, but is just this little dynamo of a woman who took care of him at home all of this time. And this was back in the days when communities weren't as dementia friendly. They weren't as friendly to older adults in general. And so, you know, again, part of my story is like, how can I make lives better for people like my family? So my research is all really personally motivated. So part of my job here at the School of Nursing is to train our nursing workforce. And I want to train the nursing workforce to be good dementia team members. So I want them to be able to go out in the community and help people with dementia, people with cognitive impairment, and their caregivers. So as we looked across the university, because one of the things that I always thought about was that it takes more than just nurses. Like, we can go out in the community and we can only do so much. There are attorneys, there are business people, there are dentists, there are lots of people who make up a community. And we need all of these people to understand what it's like to live with cognitive impairment and to be supportive. And we looked across the university. I looked across the university in terms of helping some of our pre-nursing students pick courses that would be helpful for this, helpful for teaching them to work together. And we didn't have any courses here. So I teamed up with people from the CARE, the Center for Aging Research and Education, that I'll talk a little bit more about. But one of my mentors for a long time has been Barbara Bowers, and she always gets me into trouble. So we looked across the campus. We didn't find a course, so we created a course called Community Supports for People with Dementia. the course is an interdisciplinary course, so we have people from all across, we have students from all across campus because, again, we preach, go out into the community and work with all these professions to help make the community better, but they have no background with it. They've never been taught how to do that. And so one of the things that we wanted to do was to be able to bring students together at a level when they're still young and sort of forming how they need to be working with people and actually give them the opportunity to do it. And so it's interdisciplinary, it's service learning. They actually have to put in a number of hours out with one of our 15 community partners and work with people with dementia and their caregivers. So the course has been successful. We've been able to fill the course. It's been a popular course. This is a picture from one of the last classes that we did, and we have two dementia-friendly trainers from the Alliance, from the Alzheimer's Alliance that come in, and they're always like the stars of the show. Every semester, they have to be asked back. So the other thing then that we found out as we're doing this course, we're hoping to make the world a better place, was that when caregivers and our community partners and other stakeholders would come in and work with us in class or talk to us in class, they talked continually about how, in particular, the medical field was really not dementia friendly, how clinic visits, how hospital stays were not at all helpful and were things that people avoided. We also learned about other like grassroots organizations that were trying to go out and maybe train communities to be dementia, but really sort of lacked resources to help with the training. And so we again thought to ourselves, how can we get Lisa into more trouble? So we came up with this idea to have simulations, because we use a lot of simulation within our active learning classes here at the School of Nursing. And so we came up with an idea for simulations, one of which had to be a medical, so a clinic appointment. And so we put together 6 different clinical scenarios, simulation scenarios, that ranged from a medicine, we have a restaurant, we have a banking simulation. And in the simulations we have, there's the person with dementia, there's the caregiver, and then there's the person that are interacting with the couple. So it gives everyone the ability to see each of the perspectives and to role play from that perspective. And so again, building empathy, building skill sets, building knowledge is the hopes of it. We also put together 4 videos, of which informational videos. So we have a dementia basics video, we have a communication tips and tricks video, we have 2 videos that deal with advocacy. We piloted these with our students from the School of Nursing, with students from across the campus. We went to various community groups. We sent them off to dementia care specialists. We're fortunate enough to have an international expert on dementia, Susan McFadden, who lives in the Fox Valley. We sent the toolkit off to her to say, hey, what do you think of this? Is this something? We really wanted it to be a standalone kit that people could use in their courses here at UW, but we could have grassroots community people with no medical background who could also use this to help train community members and business members to be more dementia friendly. So we sent out, we based it off of the scenarios. We had like 161 replies from just an open call that we sent out for issues that people had run into, like things that we needed to cover. And we saw a lot of the fear, the stigma, the misunderstandings, that the world was too fast-paced, nobody bothered to slow down, and all of these things. So we built these cases, and we built the toolkit. The toolkit is meant to, again, like I said, stand alone. So you have everything that you need to plan and implement and evaluate the simulations, from the tools and the equipment that you need, to the scripts, to the questions that you want to ask, to pre and post testing, to other resources that you might need. So we again, we rolled this out. The researcher side of me, of course, wants some data to show that we're actually doing some good. So we looked at some of our pre and our post, and what was really was good for me to see was that from the pre to the post, we did make an improvement in a lot of knowledge and attitudes around dementia and taking care of and interacting with people with dementia. We also saw about a halving of of the negative feelings. So those people who were uncomfortable around dementia or had issues with that, we saw that reduced. People felt that this made a difference. Qualitatively, you see some of the comments up there, and overwhelmingly it was that these were really simple things that you could do, and it didn't take a lot of time, and it really actually led to much better interactions for everybody involved. And so we were really excited about that. We are in the process of rolling that out and sending that out statewide, and we've gotten some funding from the Ejou Foundation at the Capital Times to send out some free kits, and I'll talk a little bit about that in a minute. But now I've been able to move on a little bit with another project, which actually is going to, I'm hoping to help improve the lives of residents in nursing homes in the state of Wisconsin. And this is another project that's arisen from a collaboration from the course, that Nursing 511, which has been a really valuable course for the School of Nursing and the communities. So we've got a proposal that'll be reviewed. It'll be submitted on Friday and then reviewed and hopefully be funded. And we're going to take a nursing home in Madison, and we're going to install a reminiscence room. And the reminiscence rooms are used quite often in the UK, and they're rooms that are outfitted like from the 1940s and 1950s. And one of the issues that we have here in the United States is, in particular with dementia care, is disruptive behaviors and the skyrocketing use of psychotropic drugs. And you've all seen that on the news. So we're proposing to use the reminiscence rooms with another reminiscence therapy, music and memory, to hopefully impact the number of psychotropic drugs that are used and hopefully improve some of the disruptive behaviors that we're seeing. So that's just briefly. There'll be more to come on that. This is actually, we're going to team with engineering and the School of Health and Education, or SOHE, School of Health and Ecology, sorry, I can't remember. Around this, as you can tell with the design and the implementation of the rooms, but the project is there. Finally, I need to put a shameless plug in for CARE, our Center for Aging Research and Education, which has been the glue and really represents the infrastructure around all of this kind of research that I do that's sort of outside the box. The dementia-friendly toolkits are available on the CARE website. If you go under Innovation tab, then there's the dementia-friendly toolkit tab that you can go to and order your kit. So, thank you.